Hey, future nurses. Does clinical biochemistry make your brain want to short circuit? All those lab values, electrolytes, and enzyme names swirling around like alphabet soup? Take a breath. By the end of this video, biochemistry is finally going to click. We're breaking it down into simple pieces you can actually use at the bedside. Let's go. So what even is clinical biochemistry? Simple. It's the study of the chemical processes happening inside your patient's body and how we measure them through lab work. Think of your patient's blood like a report card. Every lab value is a grade telling you how one system is performing. Your job? Read that report card and know what to do next. First up, electrolytes. These are the tiny charged particles that keep your heart beating, your muscles moving, and your nerves firing. Let's focus on the big two, sodium and potassium. Here's a memory trick. Picture a crowded elevator. Sodium loves company, so sodium follows water. Where sodium goes, water flows. So when sodium climbs too high, water shifts around and your patient can get confused, thirsty, and dried out. When sodium drops too low, cells swell and you'll see headaches, nausea, and even seizures. Now potassium. This one is all about the heart. Potassium is picky, and your heart hates when it's off, even a little. N-cell EX loves this one. Too high or too low, and you get dangerous heart rhythms. Memory trick? K for cardiac. If potassium is abnormal, put that hard on your radar first. Next, blood glucose. This is your body's fuel, and the normal range is roughly 70 to 100 milligrams per deciliter when fasting. Think of glucose like gas in a car. Too little, and the engine sputters and stalls. That's hypoglycemia, and your patient gets shaky, sweaty, and confused fast. Too much gas flooding the tank? That's hyperglycemia. Over time, it damages vessels, nerves, and organs. Quick bedside rule. With a low blood sugar and neuro changes, act now. The brain runs on glucose, so it's the first thing to complain when the tank runs dry. Last core concept. Enzymes and organ markers. These are proteins your organs release, and they tell you when something's damaged. Simple way to think about it? Enzymes are like smoke alarms. When they go off in the blood, it means there's a fire somewhere in a specific organ. Elevated liver enzymes? Fire in the liver. Elevated cardiac enzymes like troponin? Fire in the heart. You don't have to memorize every enzyme today. Just remember, rising enzymes mean an organ is stressed or injured. All right, let's put this to work with a real scenario, because this is where it all comes together. Your patient is a 68-year-old man admitted for vomiting and diarrhea over 3 days. He's weak, his heart rate is irregular, and he feels dizzy. You check his labs, his potassium comes back at 2.9. That's low. Remember our rule? K for cardiac. So you connect the dots. He's been losing fluids and electrolytes through all that vomiting and diarrhea. Low potassium explains the irregular heartbeat and the weakness. Suddenly, those symptoms aren't random. They make sense. What do? You anticipate cardiac monitoring, safe potassium replacement, and close watching of his rhythm. That right there is clinical biochemistry in action. You read the report card, and you knew exactly what your patient needed. Let's lock it in. Here's what you need to remember. Clinical biochemistry is just reading your patient's chemistry through lab values. Sodium follows water. Where sodium goes, water flows. Potassium is cardiac. Abnormal potassium means watch the heart. Glucose is fuel. Too low stalls the brain, too high damages the body. Enzymes are smoke alarms. Rising levels mean an organ is on fire. See? Not so scary after all. You just needed it in plain language. You've got this, future nurse. Every lab value tells a story, and now you know how to read it. Ready to keep building your confidence and sharpen your clinical skills? Head over to elitelearning.com for trusted, flexible nursing education you can access anytime, anywhere. Learn at your own pace and keep moving your career forward. Thanks for watching. Now go be the amazing nurse you're meant to be.